It's time for our weekly check-in with Dr. Mustafa Hirji, Niagara's Medical Officer of Health. Dr. Hirji, Niagara was left off of the Phase 3 move earlier this week. In your opinion, was that the proper thing for the government to do? Why or why not?
Yeah, so the province's planning around Stage 3 is that they want to see a region in Stage 2 for a full 4 weeks to make sure that it's not leading to a growth of infections before they make a decision on moving to Stage 3. And so what we saw on Monday is that they looked at the 24 regions that initially entered Stage 2, who actually hit 4 weeks at the end of last week, and so they were then eligible to be assessed for moving to Stage 3, and fortunately all of them moved forward. We actually hit our point of being in Stage 2 for 4 weeks at the end of this week. And so the province will then review us this weekend and make a decision on us to announce on Monday. As it stands, I think everything is looking positive for us, so I fully expect that we will be moving into Stage 3 come next week, assuming nothing unusual happens in the next few days.
Dr. Hirji, with the recent outbreak at Lynnhaven Seniors Home, 3 staff members tested positive, though they weren't showing any symptoms of COVID-19. Is this something that we have to worry about moving forward?
Yeah, so this is one of those outbreaks that I was mentioning that we are very closely paying attention to and hopefully we can limit. We do know that there's a small number of people who do have no symptoms when they get COVID-19, and it appears that this group might be that. The small caveat here is that these individuals did have some allergy-like symptoms in the past little while, and they are known to have allergies, so it's a little bit hard to say if maybe those were allergies or if these actually might have been their symptoms of COVID, where COVID is often very mild. I think it is a reminder, though, that we all need to pay very close attention to how we're feeling, really not dismiss any kind of mild symptoms because we know so many people who get COVID-19 have mild symptoms, and the last thing we want to do is be a person who's spreading that infection around. And so, again, pay attention to what symptoms we have. If you do have symptoms, stay home, call your healthcare provider, the assessment center, us in public health, so you can get tested.
Dr. Hirji, we did have a recent death due to COVID-19, but there was a significant gap in between deaths. For many weeks, we had no deaths here in the Niagara region. Is this a sign that treatments for COVID-19 are on the right track?
I think it's certainly good news that we had a long stretch where we didn't see anybody pass away from COVID, and unfortunately that streak was broken. I think that gap was really a reflection that COVID-19 is most severe for people who are elderly. And I think particularly when we think about individuals in long-term care homes who already are probably not in very good health, when an outbreak starts there, they're really the group who is at the absolute greatest risk of having a severe outcome and potentially dying. I think because we had so much success at not having any outbreaks for a while, we were able to really avoid having many deaths, and of course at the same time we weren't really having many cases in the broader community. Unfortunately, we have had a few relatively small outbreaks in the last little while, but unfortunately because of those outbreaks, we have unfortunately seen a few additional deaths. Certainly hoping we can get these outbreaks over with and we can get back to starting a new streak of not having deaths again.
Dr. Hirji, this week, St. Catharines passed its bylaw. You spoke at that meeting. The region meeting was very long in discussing the bylaw, and it will be revisited next week as well. Are you spending a lot of your time talking to different councils, and how is that affecting what is expected of you in your role as the medical officer of health?
So I characterize that as part of my duties. I'm, of course, the public health expert for the community of Niagara, and when we're dealing with important public health issues, I'm, of course, very interested in being there to provide advice and ensure that people are able to make the right decisions informed by the right evidence. I don't think it's necessarily a big drawn time. I thought the St. Catharines meeting, where I was invited to, they managed things quite well, where They had an initial discussion. They invited me for the follow-up discussion where they were very focused on making sure they got their questions asked, and so it was a really efficient use of time. I think it's a little bit of a different story with Regional Council, where, of course, as a member of the regional government, I do have to attend all of those meetings, and so I have to stay for the full amount of debate. And so that is a little bit more of a time draw. But ultimately, I'm trying to make sure that people have the best information to make the decisions that matter to the health of our community, and I'm always happy to do that.